Here together with Greta Ziubryte from Kaunas Medical Center in Lithuania. And I'd like to ask you a couple of questions. I saw recently your nice publications in the Clinical Science Monitor, and also you had the presentation here about QFR.
Yes.
And maybe the same subject, but maybe you can say something what you presented, and it was with the QFR, of course. And what is the most important message of that?
Yes, actually, I'm not sure about the publication you mentioned, but I will talk about our recent studies based on QFR. So we studied a couple thousand patients with a STEMI, and those patients at first the second procedure for them was decided whether by visual estimation only or by QFR only.
Yeah.
We have about 100 patients in both arms, and we found after 1 year that the outcomes of patients in QFR is really much better compared to only visual estimation treatment decision. Those results are kind of repeat the same what was found in Favor China, Favor 3 China trial. Also, what I presented here this year in EuroPCR, and what is a kind of new thing, I think, for QFR, that we know that during acute phase of MI, we are not able to perform wire-based physiological evaluation methods.
Yeah.
Because of the changes in dynamic things in not even in culprit area but in other arteries also. And what we found this year with this job this year, that doing QFR on acute phase angiotions with STEMI in non-culprit lesions, QFR are completely reliable compared to stable phase, while we had those patients after 3 to 4 months after the MI for non-culprit lesion for stage PCI. So I think that this is very important thing to promote QFR for wider clinical application, because we can reliably use it in acute phase to predict the significance of non-culprit lesions in STEM patients.
Yeah.
That would,
is, of course, a very important message. Yeah?
yes.
You can do it in the STEMI patients.
Yes, and even in acute phase, we don't need to wait 1 week, 3 days. We can do it from the index procedure, from primary PCI procedure.
Fantastic, a very important message. And you presented that yesterday, I believe.
Yes, yes.
You got very positive responses to that.
The audience was interested in that, and I'm happy with that also.
But the jury had some other thoughts. It was a competition.
Yes, it was a competition.
But, I mean, it is very important message, and I'm sure you're going to write that up also in the publication.
Yes, of course.
And of course, we know from earlier publications all your interest in the radiation dose also, and fluoroscopy time and so on. Was that also recorded in this particular study?
In this study, not, but we are continuing our study on, particularly on ionizing dose and other things related to QFR and other methods for physiological evaluation. And we are really on the at the end of the completing data, analyzing it, and I think by the end of June or July we will have one more publication regarding that.
Very good. And I understand you are going to defend your PhD thesis very soon.
Not defend, but I will try to finish. Yeah, to maybe to start and to finish. Yeah.
And then make the appointment for the defense.
Yes, of course. Yes, of course, of course. Yeah.
And soon also be a really interventional cardiologist, right? Certified.
Yes,
and
yes.
You can start with a team, and you do many cases at your hospital, many PCI cases.
Yes, we have, as we talked a couple of days ago and yesterday also, that we have really sick population in Lithuania. So last year, I'm not sure about the small numbers, but we have over 12,000 patients in our cath labs, in our three cath labs. So that's a huge amount on patients. Yeah.
Yeah, that is enormous number of patients that you have to go through, and you use the QFR not only for research purposes, but I believe also on a daily basis, right?
Yes, absolutely. Actually, even though QFR is not yet provided to be used in osteal lesions, for example, RC or osteal LED or circumflex, but in our clinical practice, we use it as a tool to defend the significance of those lesions, and it works really great. Some of them we evaluate also with FFR, and they are in great compliance with each other, those numbers. So this is, I believe, also is one of the thing we use QFR in future, and it's one of those things the QFR might replace in majority of case FFR and other wire-based methods.
And of course, you have been a great contributor to the Vapor 3 trial.
Thank you.
So we are only a few months left, and then we have the entire study enrolled.
I believe so.
So we are looking forward to the results, and thank you also for your contributions on all the clinical research and clinical practice that you're doing, and of course also on the Vapor 3 study.
Thank you very much.
Thank you very much, and hope you have a good time here in Paris.
Of course, as always. Thank you.
Thank you so much.
Thank you.
Thank you, Greta.